And this is a web extra of Connect New York's July edition focusing on public health. And we're going to turn our attention to the issue of enforcing restrictions on flavored vaping products, as well as limiting vaping products for New Yorkers 21 and older. And Commissioner Anderson, we heard in our conversation earlier about the State Health Commissioner questioning whether this is something that should even be the responsibility of local health departments. And I'm curious, what does this challenge represent to you? And is it something that you've got your arms wrapped around? Is it a different headache every day? What's this responsibility like?
Well, I'm interested to hear what my colleagues have to say about this. For us, it's been a very important but a very frustrating endeavor. So flavored vapes in particular, we know are disproportionately targeted towards younger children or potentially populations of color. So there's a disparity there, and it's an important public health problem. We have a mandate and a program where we go around to different convenience stores, health department staff, and try to identify who's selling flavored vapes, because they shouldn't be. We find them. They often don't show up. They sometimes pay the fine. Often they pay the fine. We often find them again. And there's very little room for enforcement or really moving the needle. This activity has been important for collecting some data, like what is the distribution of convenience stores selling these products relative to schools, trying to minimize density around high-risk areas. But overall, this is one of those activities that we are required to do, but has had, in practice, very little impact, I feel, in terms of the amount of flavored vape that's actually in our community.
Dr. Burstein, what's the experience been like in Erie County? Because one of the things that we've heard from people who want to reduce the access of flavored vaping to young people is that health departments on the local level aren't necessarily given all the tools they need to address this issue. So what's your experience been like?
Yeah, it's very frustrating. I mean, there's really no teeth in our enforcement arm. So we try to be very active with our ATUPA program, our Adolescent Tobacco Use Prevention Program, where we send a person under the age of 21, between 18 and 20 years old, into a shop that sells any type of tobacco products to see if they're able to purchase without being asked their age. And so for those stores that do sell to the minors, we're able to issue violations. However, there's very little teeth in our ability to enforce. Also with the flavored vaping products, even though that they may have them in the store, just with what New York State allows, we're not allowed to go kind of back in where they're storing them or hiding them to really identify those products. So that's a problem. So what we've developed a novel program to try to give the county health department some more larger enforcement arm. So we're going to start requiring these tobacco selling shops to acquire a permit to operate from the Erie County Health Department. And so if they need a permit, that means that we'll be able to do a better job with enforcement, because we can rescind their permit if they don't comply with the rules and regulations. And so that's a novel project that we're going to attempt.
And Director Devlin, in Wayne County, I don't imagine this mandate came with them sending an extra body to your county. No. So what has the experience been like for you, and how have you tried to approach enforcement?
Well, this is even further frustrating for a small rural county, because especially a partial service health department, because we don't have that environmental division that has the enforcement arm of the health department. So it's even more frustrating for us. We feel like our hands are tied. We rely on the Geneva District Office to do that, and they try to do as much as they can. But again, the minute they might fine a convenience store for doing it, they'll pay the fine because it's cheaper, and they'll just go right back at it the next day. So it's very frustrating even for us, even more so because we have no enforcement arm at all in regards to it.
If I can add one area for optimism, however, we were notified recently. So again, along this theme of how locally flexible dollars are very valuable, that there has been a settlement at the state level from Juul, one of the manufacturers of flavored vapes, by the New York Attorney General, with some of those funds flowing back into the counties for us to have programming that could be prevention or enforcement, or however we decide to tailor it, which is good news.
Well,
Yeah,
we'll
in
leave.
Erie County, we're going to use those dual funding also to expand our tobacco tobacco prevention programs, and hopefully with the permits in place, we'll be able to do a better job with enforcement, with reducing rescinding the permits, and so stores will not be able to operate unless they give us a plan how they're going to correct those actions.
Well, we'll leave this web extra on that positive note. This has been a bonus segment for Connect New York. Thanks for watching.